So let's talk a bit more about the education, how you're getting started here. Well, first of all, please gather up some information for us. You'll need to have your Medicare card because there are information on there that we need to get exactly as it appears on the card. Gather up your prescription bottles or make a list of those because we need to know exactly what those are. Do you take a generic drug or do you actually take the brand name? What's the milligram or microgram dosage that you take? And how often do you take it? Is it once a day, 5 times a day, or once a month? All of those make a difference in our helping you to evaluate what's the best value in a drug plan for you. Lastly, gather up the names and telephone numbers of the doctors that you see on a regular basis. Now, we may not need to put that into the system if you choose a Medigap type of plan, because there you can see any doctor that accepts Medicare, and we'll talk about that more in a moment. If you are currently enrolled in medical coverage through IHS, pre-existing conditions, I want to be very clear on this, pre-existing conditions will not limit your plan selection at this time. There is one exception to that, and that would be end-stage renal disease or kidney failure that requires dialysis. Even there, we still can work with that individual in finding the best Medicare coverage. But again, you will not be denied. You have guaranteed issue of any plan that you want at this point in time because of the way this transition has been structured by IHS. Next, please do contact us here at Extend Health. You see the phone number there, and that is in all of the printed pieces that you receive as well. It's toll-free, 866-249-7791. For those of you who like to use the internet, there is a website that has been set up, and that's where you're viewing this. So please feel free to use this for other things as well, in adding prescription drugs there or looking at and managing your account. That website is www.extendhealth.com/IHS. Here's the enrollment guide that I spoke about that you should have received in the mail already. This is a piece that prepares you for an enrollment discussion. Reviews Medicare basics. We kind of call it Medicare 101, so that it gives you a bit more education and then again encourages you to call to your benefit advisor. At Extend Health, we use some very sophisticated decision support tools. That's software on the computer. And again, you have access to some of those through the website that you're looking at right now. One of the most important of those is called the Prescription Profiler. We put in the drugs that you take, and that's why we need to know what drugs you do take. It's not because we're nosy or we just want to gather a lot of information. It's so we can help you to evaluate what is the best value for you of the different plans that are available in your area. We also have a tool called Help Me Choose. Through asking a series of questions, it helps us to very quickly narrow down the plan that's going to be the best type for you. There's a picture of your new best friend that you just haven't met yet, one of the benefit advisors at Extend Health. They are licensed insurance agents, so we call them licensed benefit advisors. As I mentioned, they're located both in Salt Lake City, Utah, and Richardson, Texas. They're not just a bunch of young kids. The average age of our benefit advisors is 43 years of age. They're available to you Monday through Friday from 7 a.m. until 7 p.m. Mountain Time. They are going to be your objective advocate. The way that we guarantee that they will be objective with you is that their compensation is absolutely neutral. That means they're not paid on a commission basis. They are paid on an hourly basis. They can receive a small performance bonus if they do a perfect job as far as Medicare compliance and in being very polite and helpful and telling you all of the correct information. To be able to do that, they receive very, very extensive training. We call it Extend University. They must be licensed in the state of Utah or Texas, wherever they're located, and then they will also have a license in the state where you are located. How's the enrollment process going to work? Well, the benefit advisors can discuss coverage options with anyone. We could discuss it with a child, a spouse, a trusted friend or neighbor, or a pastor, anyone that you would like to have assist you. However, we do need to speak to the participant, the enrollee, to get permission to speak to that person. Once we have that permission, then we can speak with anyone on your behalf. Now, the enrollee must be on the phone at the end of that call to complete the enrollment. It is recorded. Now, once you've made a coverage selection, you've evaluated those with your new best friend, the benefit advisor, and reached a consensus decision, then the enrollment is conducted via the telephone. All of the calls into and out of our enrollment and service centers are recorded, and that is for your protection. There's a card that you're going to recognize. It's your original Medicare card. If you don't know where that is, please find it. As I mentioned earlier, we will need to get some information off of that card. How's your future coverage going to work? Well, first of all, the good thing is that the primary coverage is not changing, and that is your Medicare Part A and B, also known as Original Medicare. That is the center or the heart of your coverage. What is changing is what wraps around that. That has been the group coverage from IHS. That will be ending on December 31st, and your new plan, the additional coverage of your choice, which wraps around Medicare, will begin then on January 1st of 2012. That again will be either a Medicare Advantage plan. As I mentioned, most of those include prescription drugs. So those are called MAPD, Medicare Advantage Prescription Drug Plan. Or it will be a Medigap plan plus a prescription drug or Part D plan to get your total coverage. Then there is optional dental and vision coverage if you are interested in those. Let's look a bit more about how a Medigap plan works together with a Part D drug plan. A Medigap plan again fills in the gaps from Original Medicare, those financial gaps. It helps you to pay the difference between what Medicare pays and what the doctor is billing. And these plans provide additional coverage for doctor visits, hospital stays, testing, and other expenses not covered by Original Medicare. They do not include prescription drugs, so again, the need to enroll in a separate Part D plan that supplements your Medicare to provide prescription drug coverage. Now, a special note that if you enroll in a Medigap plan, you will be required to pay your first premium at the time that you enroll. So please do be prepared for that. And the Medigap insurance companies require that. That's not our requirement at Extend Health. And they will request that that is an electronic transfer out of an account that you designate. To contrast that with a Medicare Advantage plan, a Medicare Advantage with prescription drug plan provides an all-in-one plan. It bundles your Part A and B and your prescription drug coverage together, and usually with some additional benefits. They cover your doctor visits, hospital, and your prescription drug expenses. You will have co-pays with this type of a plan. You're always going to have prescription drug co-pays. But under this type of plan, it's going to have lower premiums, and therefore you will share some of the expenses, since you're paying a lower premium, in the form of copays as you go to see your primary care doctor or a specialist, or if you needed to be admitted into the hospital. A Medicare Advantage plan steps in front of your original Medicare Part A and B, and that company manages all of your health care needs. Let's talk for a moment about something commonly called the donut hole. If you have more questions on this, certainly your benefit advisor can explain it further. I think the best news about the donut hole is that statistically about 1 in 4 people would ever reach the donut hole level, and of those, that 1 in 4, even a smaller percentage will ever go through the donut hole to reach the third phase of coverage you see there, called catastrophic coverage. For the year 2012, for deductibles and copays, you would pay up to $2,930 in actual costs of medications. What I'm saying is you will not put out $2,930 because you're paying a copay for those drugs, but that's not the actual cost or retail cost of those drugs. For this figure of $2,930, they're adding up all of the retail costs. If you reach that level of $2,930, then you would enter into the coverage gap or donut hole. Further good news about the donut hole is that it is far smaller this year than it was last year. That was part of the healthcare reform that passed through Congress last year. Under the donut hole, you would have a 50% discount on any name brand drugs, those ones you would see advertised on television, and you would then pay 86% of those far less expensive generic drugs, because Medicare then picks up the other 14%. Those numbers will continue to decrease over the next few years until in the year 2020, when the coverage gap or donut hole is essentially gone under the current legislation. If you were to go through that donut hole, and that really only happens if you have some very expensive drugs that you have to take or have a catastrophic illness. And the catastrophic phase is there to protect you, so that the most you would ever put out of your pocket is going to be less than the $4,700 figure you see there in the middle of the screen. Again, that $4,700 is based on a calculation of retail costs. And during the coverage gap, you're actually getting a 50% discount on those. So you would get through that without paying that full amount. Under catastrophic coverage, you pay either $2.60 for a generic 30-day supply drug, or $6.50 for a brand name drug, or, and this is very important and more realistic, you would probably pay 5% of the cost of the drug, whichever is greater. So a great savings to you if you do get to that point.